ready to go? Here we go. We're being recorded. Good morning. I'm State Representative Jonathan Steinberg, co-chair of the Public Health Committee. We are here today to raise bill concepts. I should remind everyone that when votes are registered, your face has to be visible. When you exclaim your support or lack thereof for any particular bill, we'd appreciate you being ready to do that and being ready to speak when it's your turn. Try to remember who's in front of you online when we do a roll call vote. Secondly, we will be holding the votes open to 11:30 this morning for those who are unable to participate immediately. So keep that in mind. We will be holding the votes open. We will not be presenting the tallies on any of our votes. Given that I still don't see Senator Anwar, I will ask our ranking members if they have any opening comments. We'll start up. First, Senator Kushner has a question.
I don't have a question, but I did hear from Senator Anwar, and he is with a patient, as you suspected, and so he won't be able to join us for a bit.
Well, we can certainly understand that. There's somebody who's doing more than talking about public health. He's doing something about it. So we will start with Senator Wong. Good morning.
Thank you, Mr. Chair. And I think we do this always on raising concepts that as we raise it and we cast a vote, it is not a for or against. It is to raise the concept for a public hearing. And I wanted to put that as a preface. So thank you for the opportunity. Eager to get to work.
For the clarification, we appreciate everybody's willingness to entertain many of these concepts so we can flesh them out further and get some public input. Senator Summers, good morning.
Good morning. My only comments are, I think we have a very, very aggressive schedule in public health. It is a short session. So I'm hoping that everybody will keep in mind that at the end of the day, it's going to be difficult to be able to pass and push through all these concepts that we're raising. So I'm hoping that we have an opportunity to prioritize those that we think are most important and we can actually work on together to get through. Thank you.
Thank you, Senator, for highlighting. Indeed, that's our intention. That's our process. The funnel starts large and then narrows considerably. And I would agree we'd probably be narrowing quite a bit in a short session. All I can say is, imagine if this was a long session, how many bills we'd have. Representative Pettit, good morning.
Good morning, Mr. Chairman. I would just echo the thoughts of the two senators, and I assume at the end of all this, we'll sort of discuss the schedule for the upcoming week, which looks like it's going to be pretty busy.
Thank you for that. When we conclude the raising of concepts, we will talk about next week. We have, well, actually, let's talk about it now since you brought it up. We have two public hearings scheduled for next week. Wednesday, the 23rd, we will be doing aid and dying. On Friday, the 25th, in conjunction with the Children's Committee in a combined public hearing, we will be hearing 5001, which just released recently, which is the Children's Mental Health Bill, and conceivably one of the Senate bills as well that is related to it. I don't know whether that's going to happen or not. We should know today. We will also likely be having one last raised bill meeting on the 24th, which we've been given permission to be on one of our off days because of taking on the Children's Mental Health Bill. And that will be one last swing at adding to our already prodigious list of concepts.
So, Mr. Chairman,
are there other questions?
Mr. Chairman, any changes or restrictions in terms of the, well, will there be anything in person or is this all a Zoom? Will there be any restrictions on sign up? And has there been consideration for time limits for public discussion?
All good questions. I do know that the caucuses are discussing potential changes to the masking rules, which may also have some impact on how we get together. I would not presume to judge how that might turn out, but I imagine that might be resolved in the next week or so. So that could change matters. Even if we say something today, it could change tomorrow. We are contemplating putting some time limits on the public hearings, but we've not yet had that conversation with the chairs and rankings, and we want to at least think it through a little bit. For those who don't know, there will be a screening meeting after today's concept raising meeting, and we will be discussing things like that. Did I answer all your questions, Representative?
You did, sir. Thank you.
And now back to Senator Summers.
Sorry, this just came up after Representative Pettit brought up, if we do have an in-person public hearing, I don't believe that we've ever had a time limit on an in-person public hearing before. So I'm just wanted to highlight that versus the hybrids that we've had in the past. There has been a time limit of, 24 hours or 6 hours, et cetera. So just wanted that for consideration. As far as I know, when we've had an in-person public hearing, we've never set a time limit. Thank you.
I think that in the past couple of years, we've set all sorts of new precedents. So that is indeed a possibility. But I think it's highly unlikely that we would change the public hearing rules on a dime for next week. So I think at least for next week, the expectation is that it will be totally remote. Representative D'Amico, did you have a question?
Well, Mr. Chair, I think you kind of satisfied it, but in response to Senator Summers, I do believe there was a time limit on, as you may recall, on the public hearing that we had on vaccinations a couple of years ago. The religious exemption for vaccinations. I believe it was a lengthy one, but I believe it was a 24-hour time limit, but there was a time limit, as I recall.
Thank you for that. Seems
I don't
like
recall that. I recall that we were there for 22 hours, but I don't recall them being a time limit. But here and there, I just wanted to bring it up that I didn't think an in-person public hearing we'd ever set a time limit. I realize that the rules have been morphed or adjusted because of the pandemic. I don't think we're probably going to be doing it in person, but I just wanted to bring that up. Thank you.
Thank you, Senator. Are there any other questions or comments before we begin to raise concepts? Representative Zupkis, good morning.
Thank you. My comment just on this is how it's always been. I don't believe we should do time limits, whether they're virtual or not. I believe our responsibility is to people that want to come up and us hear their voice. So I'm sure I'm not going to get ruled out just by the comments prior to this, but in my opinion, I don't believe in time limits. I don't think that is good legislators. I don't think that's our role. I believe that we need to hear every voice that wants to be heard. Thank you.
Thank you, Representative Cook. Good morning.
Good morning, and thank you for the acknowledgement. I just wanted to bring back, like I've done, I think, every year for the last few, given the fact that we are virtual for any of our immediate time, and then thereafter, even if we are in person, I believe that we should take our legislators, and no disrespect to all of our legislative friends out there, but our legislators should testify at the very end of any of our public hearings. I think that for consideration to our public and their time, and listen to my colleague, Representative Zupkis, on time and respect and every voice being heard, we have the ability to talk to each other. We have each other's phone numbers, and we have the ability to see each other in our office. So I believe out of respect for our community and the interest of time for them as well, that we look at only hearing testimony from our colleagues at the very end of any of our public hearings. Out for consideration, I know that is completely doable. I know that it is at the liberty of the chairs, but I think it's something, especially now with our very aggressive schedule, that we do take that into consideration to respect the public as well as our colleagues. Thank you, Mr. Chairman.
Representative Cook, sounds like we have a lot to chew over before we make our ultimate decision. To the degree that it's up to us, we will take all of these comments into consideration and promise to get back to you with our conclusion, at least for the coming week, very shortly. Representative D'Amico.
Mr. Chair, very briefly, and I apologize. I want to correct myself. I believe that Senator Summers may have had a better recollection of the time limit situation than and I want to correct what I said. I believe that she has a better recollection, so I will acknowledge that. So thank you.
Well, thank you for correcting the record and for being candid. And since I can't remember what I had for breakfast this morning, I certainly can't remember from
I don't
2
think
years
any of
ago.
us will forget that hearing. That's why it is ingrained in my brain, but thank you.
Hoping to have only memorable hearings this year. Any other comments? If not, we will begin with concepts. You see, we have 24 for today. I'm going to go through them very quickly to provide anybody a chance to ask questions, and then we will determine whether or not we can raise them en masse, if everybody's okay with that. Number one, an act concerning recruitment and retention of positions in Connecticut. This is a bill which relates to some of the legislation that you will find in House Bill 5001, the Children's Mental Health Bill, and may also be touched on by other bills. But we want to make sure we have the ability to do more if need be. I wouldn't call this precisely a placeholder bill, but it's conceivable we won't need it depending upon how some of the other legislation already in place plays out. So I beg your indulgence on that, because we all agree that recruitment and retention has become one of the most central issues that the state is facing in terms of access to quality health care. Next up is an act concerning intimate examinations. You may recall this formerly referred to as pelvic exams. We are still concerned that there seem to be practitioners out there who say this practice is still taking place. I would hope that we would get testimony that would resolve the facts of the matter, and that we dispose of this issue one way or the other for good this session. 3, an act concerning recommendations of the Breast Health and Breast Cancer Awareness Working Group that has met recently, has recommendations that will require some modest changes to statutes. 4, an act concerning flame retardants. We've met with proponents who believe that Connecticut is falling behind in this regard, and has offered up model legislation from the state of Maryland, which would form a good basis. Many states have made this, and from what I understand, though it would need to be verified, the firefighters are in support of this. They're as concerned as all of us about inhaling some of the substances that are supposedly in these flame retardants. Number 5, an act concerning the Department of Mental Health and Addiction Services recommendations regarding regional behavioral health action organizations. This is something we've asked for a while, which is the strict codifying of these organizations in statute, which we think will be very helpful for them to perform their functions. And they have been critical in helping with prevention and monitoring of many mental health programs. Number 6, an act allowing medical assistants to administer vaccines. Have we ever heard of this one before? Yeah, we've tried. We've passed it out of committee. We're going to try again. I would argue that our experience during the pandemic, where basically we allowed anybody and his sister to administer vaccines, would suggest that a medical assistant in an office setting would be able to safely administer vaccines and deal with any of the outcomes. We're hoping this is the year. 7, an act establishing a statewide stroke registry. This is something we discussed last year. Many states have it. Having a stroke registry, in theory, would promote timely response and our ability to analyze stroke trends. So this is should be a very straightforward bill. Presumably, we can find the resources for those who would actually administer the registry. 8, an act allowing dental hygienists to administer nitrous oxide, which is no laughing matter. But we would like to have a hearing on this. The hygienists, apparently in some cases, may be doing this anyway, and maybe we can find out whether that was a good thing for them to do. 9, an act concerning accessibility and affordability of mental health services. This is a broad bill which could conceivably cover any number of things that relate to the cost of delivering care, but most importantly, access. Number 10, an act concerning the Department of Public Health's recommendations regarding the Centers for Disease Control and Prevention Youth Risk Behavior Survey. I believe this is the longest title in today's grouping. The focus is really on the youth risk behavior survey, which will be an extremely valuable tool for identifying opportunities to improve delivery of care. 11, an act concerning the Department of Public Health's recommendations regarding change of ownership in healthcare facilities. This is in recognition of some efforts being made by some parties to circumvent the process in terms of shifting ownership such that the proper transparency and oversight may not be present. We want to close that loophole. 12, an act concerning the Department of Public Health recommendations regarding clinical laboratories. I do not recall the specifics on this one, but it was something that the DPH asked us to consider that would help them with their tasks. 13, an act concerning the Department of Public Health recommendations regarding Connecticut's immunization information system. This is basically to somewhat enhance and improve on the CT Wiz system. It does not represent a vaccine passport or anything of that sort, but simply the system that we have in place to expand it beyond the limited version that we have currently. 14, an act concerning the Department of Public Health's recommendations regarding Legionella mitigation. I don't know much about that, but it's something we will learn more about together. 15, an act concerning the Department of Public Health's recommendations regarding private and semi-public well testing. We know there is a real issue with well testing in the state. This is something that DPH has talked about for some years. I think it'll be a very important conversation to hear testimony on what is probably best practice at this juncture for assuring safe well water, potable well water. 16, an act concerning the Department of Public Health's recommendations regarding transfers and discharges of residential care home residents. Some of this represents learning from our experience during the pandemic, and represents DPH's efforts to update and upgrade those capabilities and protect residents. 17, an act concerning the Department of Public Health's recommendations regarding various revisions to the public health statutes. That's their broad technical bill. 18, an act concerning cremation fee. We've had this bill before, basically acknowledging that that in the case of cremation of, I guess, I think the very young, I guess would be the best description, that such fees be waived. 19, an act prohibiting certain health carriers from requiring step therapy for prescription drugs prescribed to treat behavioral health conditions. This is something we've talked about in the past, which we view that some changes here would actually promote the public health. 20, an act concerning technical standards for accessibility for medical diagnostic equipment. Another bill that we've had in the past. This is an attempt to bring Connecticut into conformance with federal law. Anybody who has any questions may ask Representative D'Amico, who is the resident expert. 21, an act increasing access to mental health medication. A very topical subject. Most of us know that medical MAT, as we call it, the use of medication in therapy has become a primary and accepted means by which to help people, and this intends to increase such access. 22, an act concerning clean and safe well water. That sounds a little familiar, but I guess it's different. 23, an act concerning drinking water supply. There's a number of issues that were raised by the various water associations. There are basically some minor technical changes. 24, an act concerning public health. I wonder where that could be. That's actually our big bill. And that is it. It may seem like a lot, but as you see, there's a significant portion that are actually DPH bills, that some of which are pretty straightforward. Several of these bills are bills that we've talked about in the past, believe we can get out of committee this year. And then there are any number of things that relate to our experience with the pandemic, and particularly with the mental health crisis in the state. I'm going to make an initial attempt to see if we can move to consider 1 through 24 altogether. I've heard from one dog so far, but anybody else? Do I have a motion?
So
No one
moved.
wants to- Moved by Representative Foster. Do I have a second?
Second.
Representative Cabros de Gras, comments? Representative Young. Oh, no, sorry, in and out. Okay. If there are no objections, might I ask, can we render this via a voice vote? Are there any objections? Seeing none, Madam Administrator, I believe we are ready for the vote. Please put your cameras on so even when you render your voice vote, we can see your smiling faces. Okay, all those in favor of raising concepts 1 through 24 on today's agenda, please indicate by saying aye.
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 All those opposed? Hearing no opposition, as we stated earlier, we will keep the votes open till 11:30 a.m. Thank you all for your support for these concepts. We will be clarifying our public hearing calendar very shortly. I would suggest you use the 3-day weekend to rest up as much as you can because we have an intense week ahead of us. But again, on behalf of the chairs, we want to thank you for your patience and understanding in that this committee has perhaps more than many chosen to treat this short session, not in terms of its shortness, but as an opportunity to address the many issues that affect Connecticut citizens' public health. We're perhaps one of the few committees in which I believe such latitude is appropriate. And if not, we are in recess until 11:30. Thank you all and see you next week.